So welcome everyone to our webinar this afternoon. We're going to be talking about an introduction to protocol development for sexual assault response teams. My name is Victoria Riechers. I use she, her pronouns, and I am the Interim National Sexual Assault Response Team Program Coordinator at the Sexual Violence Justice Institute at the Minnesota Coalition Against Sexual Assault. And this webinar was made possible by the Office on Violence Against Women. And so we just have a quick disclaimer that the opinions, findings, and conclusions and recommendations expressed in this training are those of the trainers and do not necessarily reflect the views of the Department of Justice or the Office on Violence Against Women. Our objectives for today's training are to review and define systems change and describe the 3 phases of systems change. We're going to explain the meaning and purpose of protocol development in systems change and sexual assault response team work. And then hopefully by the end of today, you all will be prepared to get started on developing your own team's protocol. Before we start in the training, I just want to give a brief overview of the Sexual Violence Justice Institute. So the Sexual Violence Justice Institute, or SVJI, is a national program operating within the Minnesota Coalition Against Sexual Assault. So we are based in Minnesota, and we create long-term sustainable systems response to sexual violence to meet the specific needs of every community. And we're part of a statewide coalition. So we have a few different values that we work from at the Minnesota Coalition Against Sexual Assault and the Sexual Violence Justice Institute. So we really focus on collaboration, integrity, courageous and bold action, preventing harm, and social justice. Some of you all may have come to our trainings before or reached out to us for technical assistance before, but I also just want to summarize some of the different things that we can provide at the Sexual Violence Justice Institute. So of course, we provide trainings. I know you are all here today for one of our trainings. We do webinars like this one. We can do workshops specifically for your team. We've participated in conferences, and we do a variety of different topics about sexual assault response teams. We also create various resources, and we'll be sharing some of those with you today. And we'll also have some links at the end of the presentation directing you to some of our resources. We can provide support, and so this is essentially what we mean by technical assistance. So we can provide support through brainstorming, meeting facilitation, problem solving, basically any problem that you're having with your sexual assault response team. You can feel free to reach out to us at the Sexual Violence Justice Institute, and we can provide support on that issue. And then we also provide connections. So if there's an issue that you bring to us that we are not able to provide support on, we can refer you all out to a different technical assistance service provider and different experts, as well as we provide connections with peers and mentors. So some of you may be already familiar with our connection calls that happen on a regular basis. And if you're not, we can definitely share more information about that. We currently have 2 national technical assistance projects that focus on sexual assault response teams. So we have one that we call our National SART project, and we provide support to ICJR grantees, rural grantees, and STOP sub-grantees. We provide support on sexual assault response teams. We provide support to statewide organizations, and we really focus on the capacity of teams and of SART leaders. Our other national sexual assault response team program is our rural SART program, and this one is very specific to rural grantees. And so very similar to what we do on our National Sexual Assault Response Team project, we provide support to sexual assault response teams in a variety of ways on that team. All right, so now that I've gone over a little bit about what SVJI does, I think we can get into today's training. So like I said, the first learning objective was all about systems change and learning about what systems change is before we dive into protocols. So what is systems change? Systems change is working toward improving individual systems' response to sexual violence while also increasing collaboration between systems. And when we're talking about systems, we're talking about a set of interconnected parts that make up a whole system, right? So each part can be its own system, right? We think about law enforcement being a system, medical being a system, advocacy being its own system. And then they also can come together to be part of a larger system, right? And so that larger system is the sexual violence response system, and it's made up of all the different individual systems that respond to sexual violence. And system change is really important because we want to think about enhancing the strengths of practice, policy, and procedures and collaboration, right? So that we are really working together efficiently and in a way that makes sense and is victim-centered. We want to address the shortcomings of any practice, policy, procedures, and collaboration, right? So we know that our systems are not perfect and there's always ways to improve what those look like. We want to ensure support and engagement for victims throughout all processes. And continuously improve over time as communities change. So we want to make sure that when we're talking about systems change, it's always a process, it's always ongoing. Now, if you've come to any of the SVJI trainings before, I'm sure you've seen this wheel. It's the phases of systems change. And we use this when we're talking about systems change, and we especially use this when we're talking about protocol development, right? You can think of this wheel as a model for protocol development. So we start with assessing the status quo, then we make the change and measure the change. So just to give you a little bit more detail, assessing the status quo is when we take stock of what we're actually doing, what our response looks like today, without thinking about necessarily what changes we're going to make. So we just want to take stock. So this could look like doing an inventory of existing service providers, bringing in the voices of victim survivors to find out what the gaps are, what's working, what's not working, doing a community needs assessment to figure out what those gaps are. There's a variety of ways this can look. Oftentimes when we're thinking about protocol development, my go-to is to map out the services and to look for ways we need or ways that we would like to improve the ways that we're responding to survivors. And then we make the change. So making the change is when we're actually doing the work of updating the protocol or creating a new protocol. Right, so that's what we're really focused on in today's training, is making that change. When we are updating a protocol, we want to think about what are all the things that we need to improve, that we want to change, and then we write it down so that we have that record and we can follow it as we go. And then the last phase of systems change is measuring the change. So we want to make sure that when we make the change, that it's actually working, right? Sometimes we make changes and they don't work out, and that's okay. That's how we learn. But we don't know if they're working or not until we measure them. So when we measure the change, we might look for things of different ways to monitor the implementation of a change. We might do surveys or focus groups to find out if this change is working. We could do case file review. There's a few different ways to do measuring the change. Another way we can think about it is evaluation, right? We want to evaluate our SART on a regular basis. And then we don't just end at measuring the change, right? We start over because systems change is a cyclical process. So we want to keep going back into assess the status quo, make the change, measure the change, right? I will often say wash, rinse, repeat, right? Just like our shampoo and conditioner bottles instruct us to do. We want to keep going. So now that we kind of have that basis in systems change, we want to talk about the foundations of creating a strong team before we get to creating that protocol. And Fatima is doing tech support. I forgot to introduce her at the beginning of today's training, but you can reach out to her if you're having any challenges today. And she has been dropping some links into the chat about different resources as we go. So she just shared the systems change handout. So if you need more information about that systems change wheel and model that we were just talking about. All right, so before we begin working on a protocol, we want to think about, is our team ready for protocol, right? How do we prepare that process of working on the protocol? So there's a few different things that we're going to want to keep in mind as we get ready for a protocol. So the first thing is, does our team have a clearly defined purpose, right? Have we already gone through the work of creating a mission statement, a vision statement? We've really solidified what it is that we do as a team. The next thing we want to think about is membership. So who is attending? Who's attending regularly? Who's not at the table, right? Do we have everyone that we need to create a protocol? Typically, we think of the bare minimum as being advocates, both systems-based and community-based advocates. We also think about law enforcement, prosecution, forensic examiners, and corrections probations folks as kind of that bare minimum. Now, of course, some of those folks may be hard to get a hold of, and so I don't want to tell you not to create a protocol if those folks are not able to attend, but that is usually what we think of as the traditional members of a team. The next thing we want to think about is buy-in from agency leadership. Right, so maybe you have some very committed members who attend the team on a regular basis, but whenever you try to make some changes, the leadership at those organizations are the roadblock, right? So we want to make sure that the agency leadership of all of the member programs are bought in and really supporting the sexual assault response team, because it's going to make doing your protocol a lot easier. Because something that might happen as a result of updating your protocol is you might realize that individual agencies may need to update their policies as well for you to update that protocol. We also want to think about the relationships that we have on our team. So do we have positive relationships with each other? Do we have strong relationships? Will our relationships survive conflict or disagreement? Because sometimes protocol updates and revisions can be they can be tense. There may be some disagreement about what needs to change and what does not need to change. And so we want to make sure we have a solid foundation for our relationships before we get started on protocols as well. Next, we want to think about how we're including victims and survivors in our protocol update, right? So maybe that's through doing a survey or some focus groups. Maybe we want to do a community needs assessment to get their voices included. Maybe we want to invite some to be part of the regular team. All right, we want to think through how we are including folks. We want to think about meeting participation, right? If folks are regularly attending, if we have a strong group of folks there. And then we also want to agree on the process for updating the protocol. So there's many different ways to update a protocol, and we'll be going through a variety of those ways in today's training. And then I'm going to go through some of this in a little bit more depth. However, we recently did a webinar that was recorded called Building a Strong Foundation, that is going to have a lot more depth on some of these foundational pieces that you're going to want to work on before starting work on your protocol. And Fatima just shared a link to that in the chat. All right, so if you want to chime in the chat, who here has mission and vision statements already created for your sexual assault response team? Let us know in the chat if you have one already. And yes, we will send out an email afterward, and we can include all of the links that we're sharing in the chat. Yes, I'm seeing a couple of SARTs coming in that do have mission and vision statements. Great. That's awesome. Yeah, so that's really a strong piece of where we want to get started. But if you don't already have a mission and vision statement, we do have a few tips for developing them. So the mission statement is all about the purpose of the SART, right? It's present focused. We want to talk about what our jurisdiction is, who will be served, what our values are. So maybe victim-centered, accountability, those could be some of our values. But the important piece is that this is really present focused. So when we think about a mission statement, we might want to say, the ABC County Sexual Assault Response Team increases access to specialized services and support and improves the multidisciplinary response for victims of sexual assault. Right, that's an example of a mission statement. When we think about our vision statement, we're wanting to think about where is our SART going, right? Vision is very future focused. It's meant to inspire where we're going. Right, so what's that long-term change a sexual assault response wants to accomplish? So an example of a vision statement for a SART could be, we want to be a model sexual assault response team for our state or for the country even. It's important to have a vision and a mission statement because this really increases that understanding and role clarity of our SART. It improves member and community engagement, right? Because people know what we're about, what we're supposed to be working on. And it can also reduce team conflict because when we are in a disagreement about the ways that we should move forward on a decision, we can look back at our mission statement and see what decision is most in line with our mission statement. How is this decision being victim-centered, right? How is this decision focused on our SART's jurisdiction, right? So we can think about our mission statement in that way so that we can reduce conflict. And then here at SVJI, we also have a mission and vision builder that Fatima is going to share in the chat. And this is a tool that you all can use to help strengthen your own mission statements. And yes, we will be sending out the PowerPoint. I'm also seeing a hand raised in the participants. So if you have a question, feel free to put it in the chat or to pop it in the Q&A function so that we can answer your question. Another thing we want to think about before we begin is our team development. So how are we strengthening our team? So what does our network look like? Are we able to get the folks who are responding to sexual violence survivors involved? Are we networking with the various different places where a survivor might disclose that they are a survivor? We also want to provide education to our team, right? So one foundational thing that we can do is cross-training. So educating each other on what our individual responses look like can be a great first step before starting to work on our protocol. We also want to develop some group norms, right? So group norms can look like how we want to treat each other in our team, how we want to work together. So a common one that you might see is step up, step back. That's one that I like to use a lot. So if you're someone who talks a lot, maybe you want to take a step back. And if you're someone who's quieter, you want to take a step up and contribute a little bit more. But so we want to work together to develop some different group norms. We also want to work at building trust, right? This comes from that relationship piece that I was emphasizing before. We want to have trust with each other because, like I said, protocol development and updating could be a time of conflict for our team. And if trust isn't there, that can be very challenging for a team to move through. And then we also want to think about having some memorandums of understanding in place. This can help with that leadership buy-in. This can help with recruiting different members to join our team. And it also really helps define our roles as team members. So one question that we get frequently is, what if a certain agency won't participate? right? And this can be a challenge when we're thinking about preparing for our protocol, because if different agencies don't want to participate, it can make our protocol not as helpful or as useful as we would like it to be. So some different suggestions that we have are to do what we call a stakeholder analysis. So this is looking at who is involved, who the stakeholders are, and who has different positional power in our community, right? So this might be the prosecutor has quite a bit of positional power in our community. Oftentimes, many SARTs have the prosecutor as someone who has the most positional power. And maybe the prosecutor is really supportive of creating a protocol. So you might be able to work with that prosecutor to put a little bit of pressure on the organizations and agencies that are maybe a little bit hesitant to participate in the protocol development. Right, it's going to look different for every community, but we want to think about how we can leverage our networks and our contacts to see who we can get to participate and use that pressure. And then if folks don't want to participate, that's ultimately their choice, right? And you can still move forward without them when you're developing the protocol. And then maybe in a year or two, you can reach back out, show them the results of how successful your protocol has been and how it's improved the response for your community. And then maybe they'll be more interested in joining. Before starting on your protocol, you also want to make sure you think about, have you assessed the status quo, right? That #1 step in our systems change wheel. Some different ways that we can do this is mapping out the current response, right? So this often looks like taking a few different scenarios, like the victim called 911, or the survivor showed up at the hospital at the ER, or the survivor contacted a community-based advocacy program. Right, so a few different scenarios of how survivors reach out for services or for support following a sexual assault. And you can just map out informally what that response will look like. So if a survivor calls 911, what happens next, right? So usually that's going to be like dispatch will send the patrol to speak with the survivor, and then patrol might contact the detective, right? There's going to be a few different ways that those scenarios can play out. And so mapping out what that looks like can be a really helpful starting point when talking about your protocol. Doing a community and needs assessment can be really helpful to identify different gaps in a more systematic way. When we map out the current response, that's going to be pretty subjective to our own experiences and what we think the current response is. But doing a community needs assessment might be a little bit more helpful to find out what it actually looks like, because we might think we know what the response looks like, but we could be wrong, and people could be having a very different experience to what we think the response is. We also want to engage different stakeholders in finding out what they think the response is as well. So you might be on a team that has 20 different members, and all of those members have their own response to sexual violence. And we want to make sure that what they think their response is the same as what we think their response is, right? And so we want to make sure that our team's response is aligned before we get started working on that protocol, because working on the protocol is that opportunity that we have to align the response. Because like if law enforcement thinks one thing is happening and the forensic nurse thinks another thing is happening, there might be some conflict that happens, and survivors might get an inconsistent experience when they're going through these different systems. So this is really important for us to clarify as we go. When we're thinking about engaging our community and doing a community needs assessment, we want to think about who we're talking to, what we're going to talk about, where, we're looking and how we are engaging them, right? So who we're talking about could be, what are the different populations, the different demographics in our community, right? We want to make sure that we are including all different types of community members. We also want to think about who are those community leaders, right? Especially for more marginalized populations, involvement from the community leaders can be a really important way to start building trust with different communities. We want to think about talking specifically with victims and survivors when we're thinking about engaging our community and learning from them. We could also consider talking to people who cause harm as well, to learn more about what that experience was like going through the system for them. And we also want to think about our systems partners, because as we're doing systems change work, we need to really focus that on our systems. When we think about the what, we want to think about what resources do folks have following a sexual assault? What needs do they have? What challenges are folks experiencing? We also want to think about what our current partnerships are, right? Do we have strong partnerships? Are there partners who are missing from the table? And we also want to think about what is the community's current level of awareness of sexual assault in the community, right? Sometimes communities think that doesn't happen here. And we know that's just not the case, right? But it can be really helpful to be aware of what the community thinks about sexual violence and what the sexual violence response is. Oftentimes, communities don't even know that there's a sexual assault response team. When we think about where, we want to think about our geography, right? Are we in a rural area? Are we in an urban area? How much space does our team cover, right? I've worked with SARTs that cover like 2 to 3 hour drive of space, right? They're a huge, huge county. And so we want to think about how we're including the whole jurisdiction of our team, right? Oftentimes, something I've seen with different rural counties is that they might be only focused on the county seat, right? The main town in that county. And then there's a few more, even more rural areas that are not being included. So how are we including those folks? What about our neighboring jurisdictions? This can be especially helpful if we, in our jurisdiction, don't have a lot of resources. So how are we working with our neighbors to fill in some of those gaps? And how do our neighbors and the service providers in our neighboring counties, how do they feel about filling in some of those gaps, right? Because we all have limited resources. We also could think about the weather and how that's going to impact our community, as well as different community traditions, the languages that we speak, and our beliefs and our values. And then lastly, how. We want to think about how systems are currently working together, right? And so with this, I like to think of focusing on collaboration gaps rather than focusing on service gaps. There's always going to be services gaps, right? Because some communities just can't sustain all of the services that we wish we could have available, right? But we could think more about collaboration gaps and how are we working together? And that can be a really important part of the protocol. And so when we think about doing a community needs assessment, we want to think about, where do people go for help after experiencing sexual violence? What do people in the community know about sexual violence? And what do you think is needed to improve the response to sexual violence in the community? And so I think Fatima is going to drop in the chat a resource for doing community needs assessments called Listening to Our Communities Toolkit. And that resource is specifically designed for community-based programs responding to sexual violence. However, you can adapt it for your SART to get started on doing a community needs assessment. And then we also want to think about victim survivor input. And this is something that we could do as part of our community needs assessment, or is something that we can do specific to focusing on victim survivor input. So we want to think about how is the response to sexual violence currently working in our community when we're talking with victims and survivors, right? And this is really important for when we're thinking about what we think our response is versus what our response is actually looking like on the ground, right? Because we could think our response is happening one way, but then victims and survivors are telling us that it's actually not happening like that at all. And that's really important for us to be aware of as we work on our protocol. Because we need to be aware of our blind spots. So what blind spots does our team have? What are we missing in that response? And then a few different ways to gather some input is through interviews, focus groups, and surveys that we could do with our community and with victims and survivors. So has anyone on today's call done a community needs assessment as part of their preparation of working on a protocol? Or as part of your involvement in a sexual assault response team? Yes, I'm seeing a couple yeses come in. And for folks who have done a community needs assessment, what are some of the key takeaways that you learned and were able to adapt in your team? So what were your key takeaways from doing a community needs assessment for your SART? Yeah, so folks were able to improve services for less commonly thought of groups like elderly folks and the Native community. Yeah, that's a great example. We learned we need to involve more community members and representing other populations. Absolutely. Any other insights folks had from doing their community needs assessments? You were able to identify many gaps, determined resources available, and see who else we needed at the table for the conversation. Excellent. Yeah, I think community needs assessments are super important for learning what we don't know, right? Because we all know what we do, what our response is, but we don't know what we don't know. And a community needs assessment is a great way of doing that. Yeah, so I'm seeing the question of how do you perform the needs assessment? So there's a few different ways, Mary, to do the community needs assessment. And Fatima, do you want to reshare the toolkit that you shared earlier? So that toolkit has a lot of really helpful information about how to perform a community needs assessment. And so like I said, that one is really focused on community-based organizations that provide services to sexual assault survivors. However, you should be able to adapt it to your team. And so you can like change up the questions that are asked so that you find out what your team is really looking for. But so there's a variety of ways of doing this. You can do surveys, interviews, focus groups. You'll really want to reach out to various folks in your community as well as you go about this. And that toolkit's going to have a lot more helpful suggestions as well than what we have time for today. Awesome. So now that we have really built that foundation of what we need before we start working on our protocol, and we've assessed the status quo, we've identified some different things that we might need to change because of our assessment of the status quo. Now we can kind of get started on our protocol. So what is a protocol? So a protocol for sexual assault response team is really guidelines and model practices. So we are writing down what that response to a survivor should look like, and what is going to happen when someone discloses sexual violence to the various members of a sexual assault response team. We also think of it as a supplement to training. So it's a supplement to internal policies as well. And by a supplement to internal policies, what I mean there is that each of our organizations in our team, we have our own policies about how we respond to victims and survivors. And this protocol is kind of bringing all of them together into one cohesive response, right? So we want to be working together so that our protocol is accurately reflecting our internal policies. And it could be a conversation starter of what internal policies may need to change. It's also a supplement to training because, like I said before, we might want to do a little bit of cross training so that everyone understands each other's response at the beginning. But a protocol is a way to write down what those responses look like. And so that you can always reference that if you aren't sure what the response is supposed to look like from any agency on the team. It's not a replacement for the training, but it is definitely something that folks should be able to go back and reference. Protocols are also inherently collaborative because we need all of our responses together in that protocol to have a successful protocol. And then it's also a living document and it's being continuously improved. So we should always be thinking about updating our protocol. Once we've finished our protocol, it doesn't stop there, right? We have to implement our protocol. We have to make sure our protocol is working. And then we always want to be updating it every few years or so. What makes a good protocol? So a good protocol is going to be consistent, comprehensive, coordinated, continuous, and community specific. Right, so what does this mean? So I think consistent is pretty straightforward, right? We want all victims and survivors to have the same response from different agency services providers. Right, so we want to make sure that if someone is calling 911 because they've experienced a sexual assault, that all survivors who call 911 are having the same response. And same for any other discipline. So if they go to the ER of the hospital, if they go to a family justice center, if they go to a community-based advocacy program, right? We want to make sure that those responses are consistent. With comprehensive, we want to make sure our response is informed by practice, victims, and the realities of sexual assault, right? So we want to make sure that our response is informed by what is considered best practice or promising practices. We want to make sure that we are being victim-centered in everything that we do, and that we're being trauma-informed in everything that we do. When it comes to coordinated, we want to think about, are we organizing our response in a way that's unified for responders and supportive for victims, right? So how are we coordinating together to create that best response for survivors? When we think about continuous, we want to think about, are we reviewing the impact of our response on victims and in our agencies in an ongoing manner? Right, so it doesn't just stop with the completion of writing the protocol. We want that living document. We want to be continuously updating. And then community specific. Is our response defined by and designed for the community where it will be used? Right, we don't just want to copy and paste someone else's protocol into our community because our community is unique, right? And what works for one community may not work for another community. So we really want to make sure that we are being very community specific as we design our protocol. Why do we need a protocol? So a protocol provides a bridge between the different laws and practices in our jurisdiction and the different agencies and systems in our system, right? So what does that mean? So really that's going to mean, how is our team following the laws and practices, and how is our team responding in the best possible way to survivors of sexual violence? So what is the purpose of our protocol? So we want to think about defining our agency roles and responsibilities. A lot of protocols that I've read or supported the development of will have different sections for every single discipline on their team. So they'll have a section for law enforcement, a section for healthcare providers, a section for advocates, and more, right? Whoever's on the team, education, educational institutions, they'll have their own section about what that response looks like. We'll also want to think about how this reflects our mission, right? And how this reflects the purpose of our team, right? Our protocol should be very much in line with whatever our mission is for the team. And we also want to focus on improvements in our policies and practices as we go about improving our protocol and writing our protocol for the first time. All right, so the big question is, how do we get started, right? So if we've done all of the background work that we need to do, right? Like maybe the community needs assessment, figuring out what the current response is, assessing the status quo. We've done all of that. So now how do we get started in writing our protocol? So for folks who have done a protocol before, what did you do to get started? What are your recommendations? You can pop them in the chat. So for folks who have written a protocol before for their team, what are your recommendations in how to get started? Reviewed other protocols. Yeah, it can definitely be helpful to check out what other teams are doing for that inspiration and figuring out how to get started. What else? We assigned one staff to go through training and bring back the most current effective best practices and training material for consistency across all staff. Awesome. Any other ideas for how to get started? Did lots of research on other SARTs, developed a subcommittee to come up with recommendations to be approved by other team members. Yeah, a subcommittee is definitely one of the strategies that teams will use. Yeah, divide team into committee by discipline to determine the protocol for each area. Having specific questionnaires for specific communities. Yeah, these are all great ways to get started. So thank you all for those suggestions. I love learning from teams, the different strategies they're using, as well as our suggestions that we have. So one of the first steps we have is to determine the process that you all want to use to develop your protocol or to edit your protocol, right? So who is leading that process, right? I know one of you all had different assignments for different team members as your suggestion. So who is working on the protocol? who's leading it, right? Who is the one with the final like authority, or the one who's keeping the protocol going, right? That protocol update going. What are the individual roles? So maybe you divide it among a few different folks in your team. So what is everyone's individual role for updating the protocol? And I know one of you all suggested dividing the team into committees by discipline area. And that's actually a strategy I've also used to update protocols. And so we had different roles within those little committees. We also want to think about the meeting logistics. So are we having this as a standing agenda item for our meetings? Are we having a big separate meeting that's only focused on protocols? We want to think about those different logistics. We also then want to think about drafting. So who is actually doing the writing? I think this is one of those big questions, right? Who's doing the writing? Lots of people might be involved in the discussion, but then who's actually writing it? And then what's the review process going to be like, and how are we providing feedback on the different aspects of the protocol, right? So we want to figure out a process for that as well. There's a few different approaches that we can think about. And so a couple of you all have already suggested this. So having work groups based on discipline, having a single writer taking input from others. I've definitely seen this one a lot as well. So having someone who maybe there's someone on your team who's a really great writer and they want to lead that writing process. And then they can meet with others. Maybe you still divide up by discipline and the writer will go to all of those meetings to get that input. You could also do group writing and have an editor organize everything. So I've also seen teams when they divide out by discipline like that, the discipline does their own writing for their own section and then the editor brings it all together. Oftentimes folks will want to have a multidisciplinary review process. So thinking about how, especially if you divide up by discipline to work on your individual section, how is the rest of the team going to be reviewing that piece? One way I've seen a team do it is they created slides for all of the different sections, and then they presented the slides on the protocol at the meeting. And then had time for folks to provide feedback. Another way, of course, is to send it out as a Word document for folks to review and provide feedback. We also want to think about internal reviews, right? So sometimes we might have different strategies we're coming up with in our team, but then the internal folks of the different member organizations may need to review this process, right? So one time I was working with a team that they wanted to change in the protocol the ways that the victim advocate was notified for the county, right? Because they had found through assessing the status quo that the victim advocate wasn't always getting notified consistently for different cases when survivors were calling 911 or reporting to law enforcement. And so one of the changes that they decided to make was that they were actually going to have 911 dispatch contact the advocate every time there was a sexual assault disclosure to law enforcement. But so this then had to be sent to dispatch to make sure that that was okay with them and to approve it and to update all of their policies about how they were going to contact the victim advocate and what that was going to look like for that community. Right, so we want to make sure that each member organization has the opportunity to review what that could look like. Another example that I have of that is I was working with a SART that the hospital, during the protocol update, the hospital decided that they were no longer going to always call law enforcement when they had a survivor come into the ER. Because this hospital, they were not legally mandated to call law enforcement when there was a sexual assault, but they always had that practice of calling law if a survivor does not want to call law enforcement, it's not the best practice for the hospital to call on their behalf. And so then the hospital updated their policy so that it was the survivor's decision if the hospital called law enforcement or not. And so then they had to go internally to update that policy as well. And then lastly, we again want to think about that victim survivor input. So how are victims and survivors being included in the ways we're updating and writing the protocol? So maybe there are folks on your team who are representing victims and survivors for your team. Of course, there's likely people on your team who identify as victim survivors, regardless of whether or not they have disclosed that to the team. But we want to think about how we are intentionally including survivors in updating the protocol. And I'm sure you're thinking that I sound like a broken record because I have talked about that a lot, but we really want to emphasize that, that inclusion of victims and survivors input. And then I know a lot of you mentioned looking at other SARTs, what they were doing. And so we do have a couple of resources to share. We definitely do not recommend copying and pasting from other teams, but we do have a protocol template that folks can use, and you can download it from our website and use that as a starting point. So I think Fatima is going to share that in the chat. And then the NSVRC has a SART toolkit where they list several sample protocols. And so you can look to see what other states are doing. Some states have like a statewide protocol. And so if you work in that state, that can be a really solid foundation to begin a protocol. And then of course, if you do that, you'll want to make sure you are very intentional about tailoring it to your specific community. If you use any of these kind of pre-made templates or samples. As you work on your protocol, there may be some tension points and conflict, like I mentioned, right? Because there's going to be differences in everyone's perspective, because we all come from different disciplines. We all have different values and priorities of what the sexual violence response should look like, right? For example, advocates, their priority is providing survivors with choice and empowerment, right? Whereas law enforcement's priority is investigating the crime, and healthcare's priority is taking care of their patients, right? So we all have these different perspectives and priorities, as well as goals. And so those can be different tension points and conflict points as we work on this protocol together. So we want to think about how are we honoring all of these different values and priorities that we have while being victim-centered. We also might have different individual personalities on our team, right? Sometimes people have strong personalities. Sometimes people are really quiet. And so for folks who are maybe the loudest voice in the room, how are we working with those folks to make sure that we hear the quietest voices in the room as well? We might want to take some time to think about the way we define sexual violence, the way we define victim-centered, and some of these different terms that all of us may use, but so that we have a collective understanding as a group of what those terms are and what they mean in our protocol. And finally, we also want to make sure that we have a clear understanding of our different roles and what our values are and what they look like, so that when we do have these different conflicts, we can think about, oh, this is important to this person because their priority and goal is to investigate the crime and prevent it from happening again. Or we can think about this person has really strict confidentiality obligations, and so they're going to frame everything through that lens. Right, so we want to think about all of these different pieces as we navigate conflict. So why can't we do what the XYZ community is doing? So you probably already know this, but communities are different, right? Every community is unique. And so we want our protocols to reflect that uniqueness, right? We all have different needs and different resources, right? So some communities are going to be very resource rich. They're going to have a lot of different folks who attend the SART. They're going to have a lot of different options for survivors. However, some communities may not have those options, right? I've worked with communities that don't have a forensic exam location in the whole county, and they have to drive several hours to get a forensic exam, right? And so because of that, their protocol is going to look very, very different from a community that has a ton of resources, right? Our communities are also very different in our demographics, right? Who makes up that community is really going to impact how we respond to sexual violence, as well as the geography, right? Some SARTs, especially SARTs that cover a whole county, if they have a very, very large county, that could be several hours of driving distance. Maybe there's geography issues that could impact the internet or the ways that we communicate with each other virtually. And that's going to impact what our response looks like, right? So I know in communities that have mountains, the internet access can be a big challenge on a consistent basis because those mountains can kind of disrupt the signal. This is something I encountered when I worked in Arizona in the past. And so we want to think about all of these different things as we are considering some of the different strategies for creating our protocol. This is, again, why we do not want to copy and paste from another team and just do what they're doing. All right, so now that we've kind of talked through what the protocol updating process can look like and some different strategies for updating it, I also want us to think about when this work will be done. What is realistic for our team? So I want us to think about protocol writing as a marathon and not a sprint. Protocol writing and protocol updates can take a really long time. And I don't want to scare you with that, but I think thinking about a year as the minimum amount of time to update a protocol is a really good starting point, right? I've known teams who've done it faster than a year, but I think a year is a pretty standard average for how long it takes. And this is because there's a lot of work that goes into doing your protocol, right? You might need to break it up into smaller, more manageable tasks. If you are the SART coordinator and you're kind of leading this process, it can be really helpful to set some deadlines and to keep to those deadlines for different folks. We want to be ambitious with our timeline, but we also want to be realistic, right? There are many things that can happen during protocol writing. Setbacks might happen. Maybe there's a conflict that comes up and a disagreement that you didn't see coming. And so you might need to take a few meetings to like hash that out and figure out what that agreement's going to look like. And originally you thought that this was going to take just one meeting to work on. But we just want to make sure we're continuing to move forward as we work on the protocol. Some things that you can set deadlines around are having a first draft or second draft done, maybe doing presentations of the drafts to the team. We can have deadlines for reviewing and editing, getting that feedback in. And we also want to have breaks from the protocol because sometimes working on the protocol a lot is very tiring. And so depending on whatever strategy we use, so let's say we are updating our protocol as a standing agenda item in our meetings. That timeline is going to look different than a subcommittee who's working on the protocol, right? The subcommittee might be able to do it a little bit faster than doing it in the meeting. And so we want to think about what our timeline looks like, as well as what our strategy for updating the protocol looks like as well. We also want to think about once the protocol is done, how we're publishing it, how we're implementing it, how we're training on it, and how we're providing community awareness on it. So we want to build that into our timeline as well. But so like I said, a year is pretty average for updating a protocol, and things happen, so it could take even longer than a year. And it's important for us to keep going and to keep working on the protocol. so that we are able to finish it. So knowing all of that, I really want to stress to be flexible as well. So we know that your timeline might change, right? Like you might have project managed it all out. You have like a spreadsheet with due dates and it's like really pretty. That's going to change, right, as you work on it. So we need to make sure we're staying flexible. When we think about our protocol, we also want to think about what the end product is going to look like. So we want to make sure that it's practical and that it's going to be useful for our team. So what format is going to work best for your team, right? I know a lot of teams will write up their protocol as a Word document, and that's great. But sometimes like 100-page Word document, if it's 100 pages, is not very practical because that's a lot to read. So we might want to think about how long our protocol is, how much information's in it. Is it too much? Is it useful? And we could also think about different formats. So there was one team that I worked with who really kept their protocol in PowerPoint slide format because it was just a lot easier to digest and to update for them. And that's what worked for their community. But like I said, a lot of communities will do like a Word document as their product. We also want to think about if it's purposeful, right? What is the purpose of each part of the protocol? So if you took a look at the templates that Fatima shared, there's different headings for the different sections. So are all of those headings needed for your team? What's the purpose of all of those different sections? We also want the protocol to be easy to use and flexible, right? So how is this useful? How are we going to be able to update this as we go? And really, we want to focus on what works best for our team and our community. When we think about organizing our protocol, there's some different ways that we can organize our protocol. So many protocols will organize themselves by discipline. I think this is a very common way to do it, where each discipline has their own section, right? And they might talk about the philosophy of that discipline. So like I said, like law enforcement's philosophy is investigating crime. And then they're going to go through the core discipline model practices, right? So what does that investigation look like? What are those best practices for investigation and law enforcement response? They might have some additional considerations. Like I know some different considerations I've seen for law enforcement is how are we using body cameras, right? If your law enforcement has body cams, what's the best practices for responding to a sexual assault survivor when you have a body camera? That's something I've seen. Any relevant statutes. So every state and our local jurisdiction, we might have these different laws that apply to us. And so what are the relevant statutes for each discipline, right? So one thing that I think about is mandatory reporting. So who has those obligations? And so we want to include that information in our protocol. Any cultural considerations in our response, right? And that's going to vary based on your community and the demographics of your community. And also any key terms and definitions, right? So every discipline has their own jargon and their own way of talking about things and talking about sexual violence. And so what is that jargon? And how can we make that really clear for the rest of our team so that folks know what we're talking about? Another way that folks can organize their protocol is by the response. And so this can be, rather than discipline, like each discipline writes a section, this is like an overall response as the framework. So this is still going to have discipline-specific considerations, and the discipline-specific considerations might be different subsections of the protocol, but it's not as discipline-specific as a discipline-specific organized protocol. But again, we're going to want to think about what are those elements for a strong response. And we're going to focus on the cohesion of how these disciplines work together. And that's also going to be in the discipline-specific response as well. And then similarly, including any relevant statutes for your team and any key terms and definitions. All right, so now you've finished your protocol. You've written it all up. It's been a year, so congratulations. Now we want to think about implementing the protocol, right? So we want to make sure we're developing a plan that once we're done with the protocol, we're going to implement it, because once we finish writing it, if we don't implement it, then it just becomes a piece of paper that we're not using. And we don't want to go through all the work of updating and writing our protocol just to not use it. So when we implement our protocol, we want to think about maybe we need to develop or renew our interagency agreements, right? So we went through getting our MOUs before starting our protocol, but now that we've finished our protocol, we might need to update those MOUs. They might be out of date, so we want to check on that. We want to think about how we're distributing our protocol, right? How we're getting the word out about the protocol, how we're training on the protocol, right? So maybe the folks who attend your sexual assault response meeting are the forensic nurses, but how are the forensic nurses letting the ER staff know what the new protocol says, right? How are the detectives letting patrol know what the new protocol says, right? So how are we training our agencies on the protocol now that it's in place, right? Because if we don't do that, then the protocol is not going to be implemented. We also want to think about how we're informing our community about the protocol and how we're staying accountable to the protocol, right? So how are we checking on ourselves to make sure that we are accountable and staying in line with our protocol? So we're going to break this down a little bit. So what needs to happen at the agency level? So I know I talked, I gave a few examples of some different agencies that had to go update some internal policies after updating the protocol, right? So that could be something that comes up in your community. So what are those internal policies that we might want to update so that it's a better response to victims and survivors? Again, we want to develop or renew our MOUs and agreements. We want to make sure we're training on any changes in the processes or procedures that happen, especially at the agency level. We want to have agency-specific trainings. And I would really recommend whoever the agency representative on your team is, they should probably be the one doing the training, right? So whoever the law enforcement representative is on the team, thinking about having that law enforcement person train their law enforcement agency, having the advocate train their advocacy agency, right? I think that can be a really good strategy for those agency-specific trainings. Some more considerations for implementing the plan is how will this protocol be distributed? Right, so are you just emailing it out to everyone? Are you, maybe you could have an event to really kind of hype it up a little bit so that there's more interest in this new protocol. But we want to think about how we're distributing it and getting the word out about the protocol. We want to think about who's providing trainings on the protocol and how frequent there'll be trainings on the protocol, right? Because we know there's a lot of turnover in staff. And so do we want to incorporate training on the protocol for all orientation of new staff at our different member agencies? Right? How are we going to make sure that new staff are familiar with the protocol? We also want to think about how will the team know if the protocol is being followed, right? And this is when we get into the third step of our systems change wheel of measuring the change. So how are we going to know if the protocol is being followed? How are we going to check on ourselves to make sure that we are doing what we say we're doing? Right, so then we might want to think about different evaluation strategies and plan for that. And how will team member agencies be accountable to the protocol? Right, and so this could be something that we do as a team where I know sometimes teams will have like a standing agenda item for different challenges that they're experiencing. And so maybe different team members might notice some trends over time, like the forensic nurse, maybe the protocol says the forensic nurse examiner is supposed to wait for the advocate to arrive before starting the forensic exam. And maybe the advocate over time is noticing that sometimes the forensic nurses aren't doing that, but the protocol says they're supposed to. And so then they could maybe bring that to the meeting to have that accountability and to have a little discussion just to remind each other about what the protocol says. And then we also want to think about when the team will revisit the protocol. I know some teams will revisit like every 3 to 4 years, but we want to think about once we've finished updating it, when are we going to check in on it again? When are we going to update it again? Because like we said at the beginning, this is a living document and should be continuously updated as we do our work. We also then want to think about how the community will be informed. And when we think about the community being informed about our protocol, this is when it's really crucial that we have community involvement from the very beginning, right? So maybe through our community needs assessment, the ways that we're including victim survivor voices in updating the protocol, we want that from the beginning so that when we release the protocol and we finish the protocol, the community is expecting it, right? They're not surprised that we created a protocol. We're being accountable to the community by creating this protocol, and their input should hopefully be reflected in this protocol, right? And so that's going to create a lot more buy-in from the community. We also want to think about why is it important the community knows, right? It's important for communities to know that we have a new protocol, because oftentimes communities aren't even aware that there is a protocol or there is a team. And there tends to be limited awareness about sexual violence response in general in a lot of communities, right? And so talking about the protocol can be a really unique time to really inform the community of what the sexual violence response is in your community. And then there's a few different ways we can think about getting the word out. So I know some different SARTs have done press releases about their protocol. Sometimes folks will have a launch event. I've known different teams to line it up with Sexual Assault Awareness a month, so that they have like a big launch event of their protocol in April. Some teams will have social media accounts and they can release it through social media. And we also want to revisit how we did our community needs assessment. So when we did the community needs assessment, how did we get the word out about that? How did we recruit folks to be a part of that? And we can think about using that strategy as a way to get the word out as well. But so remember, systems change and protocol development is a process. So like I said, wash, rinse, repeat. We want to assess the status quo, make the change, measure the change, and then start all over again. So once your protocol is done, we want to make sure that we are always continuously updating, continuously improving. All right, so now I've left about 15 minutes for questions, and I see a couple in the chat, so I'm going to take a look at those. But then feel free to type your questions in the chat or type your questions in the Q&A, and then I will get to them. So the first question I see is, how often do you suggest SARTs meet? Monthly, quarterly? Yeah, so I think especially for new teams, I always recommend that you meet monthly at first, because especially when you're new, sometimes we can lose momentum if we're meeting less frequently than monthly. Once you're more established, you might want to switch to bi-monthly or quarterly, right? But usually monthly is what I see as the most common and one of the better ways to not lose momentum in what our teams are working on. So then the next question I see is, if we are creating a SART for a college campus, is it necessary to update the community around the campus? We have a SART in our county that would help and support all community members. We were trying to start a specific one for our campus to make sure our students are supported. Yeah, I think that's a great question. I would say yes, that you would still want to update the community around the campus. And like you might be able to specify that this is only for college students or only for like college community members, right? Like maybe faculty and folks are included in that. But we know a lot of college students live off campus in the community. And so thinking about those folks, if we only focus on notifying the campus, they might miss the message that it's available for them as well if they're living off campus. And then the students and faculty who live off campus, that's just another choice that they have if they want to involve the college campus SART or the community SART. So I still think it's a good idea to let the community members know as well. Any other questions? All right, so I'm seeing a question, how do I navigate pushback or some of the team not being on board with creating a protocol? I feel like a lot of our members see our SART as just another meeting they have to attend. I'm working on this. That is a great question. This is definitely something that we've seen with a variety of teams that we've supported over the years. And so I think I would go back to when we were talking earlier about conflict and folks not wanting to be involved. This could be a good time to do a stakeholder analysis and figure out who are the key players and the key movers in your community. So maybe that's the prosecutor, or maybe that's like someone who's really involved in the community, and see how you can work with them to kind of push these other folks into being more on board with creating a protocol. Now that might not work depending on who those folks are and if they are supportive of your SART in the community that you work in. Another thing to think about is, especially when the SART feels like it's just a meeting to meet, working on your protocol is a great opportunity to demonstrate that it's not just a meeting to meet, right? It's a project that your team can be working on. And so framing it as really an outcome or an output of the team could be a way to get a little bit more interest and to reinvigorate the team. I know when teams are really struggling with that meeting to meet kind of mentality, we often suggest revisiting the protocol to really think about how we want to reframe our SART, right? Because updating the protocol could be a way for us to really figure out how our meetings are going to work and how we need to have new strategies of working together. So another question that I'm seeing, should a SART also be meeting immediately when an assault happens, or should it only be monthly, bi-monthly, et cetera, to review cases and make necessary changes? Our campus is also in the process of creating a CCRT for grant with OVW. Yeah, so in general, when we're talking about sexual assault response teams, we're really focused on the systems change aspect of the team. So like, how is the team working to really improve the overall response and those individual systems response to the team? So maybe for your team, that because it's campus, like maybe it's like, how can the campus police improve their response overall? How can the campus healthcare provider improve their response overall? And so we focus on that instead of focusing on those individual cases, so that we call that an acute SART response team, because focusing on those individual cases often doesn't allow us the time to work on the systems change piece. And the systems change piece is ultimately going to have more of an impact. Also, when we work on individual cases, there's a lot of confidentiality considerations. A lot of times, community-based advocates are not able to be on teams that talk about like the specific cases because of their confidentiality requirements. And because community-based advocates are often considered the voice of victims and survivors, that's a really crucial element that we don't want to miss out on in our team. So we want to think about that as well. How do we ensure the training component of SARTs are implemented in rural counties with meetings that aren't yet as successfully structured? Marissa, I'm not sure I'm understanding your question. Are you talking about maybe the meetings aren't meeting super regularly? And so how do we do training? Is that what you're meaning? So let me know in the chat, Marissa, if you can clarify your question for me, because I don't think I'm fully understanding it. Another question I'm seeing is, who do you suggest should be facilitating these meetings? It seems like it's community-based advocacy groups. Yeah, that's a great question. So anyone on the team can facilitate the meetings. We often recommend having a designated coordinator, so a SART coordinator for the different teams. The coordinator may or may not be the facilitator. I think that's going to be up to your team. Oftentimes the SART coordinator is the facilitator of the meeting, but maybe you have a SART coordinator who just doesn't like facilitating meetings, so they partner up with someone and this other person facilitates the meetings instead. So that's going to just be your team's decision. And then you said it seems like community-based advocacy groups tend to do it. That's true. A lot of SART coordinators tend to be from community-based advocacy organizations, but they don't have to be. They just tend to be. Okay, so Marissa, I'm coming back to your question. So you said the teams are meeting irregularly as well as expanding into very rural areas, and they're hesitant to add training times to the SART meeting. Yeah, so this sounds a little challenging, but I think before you start working on your protocol, one thing to focus on is really strengthening those team meetings, right? So really trying to figure out what works best for these rural areas as far as what meetings can look like, the different ways that you can build those relationships before adding those training times and before adding the protocol, because I think building those relationships is going to be the first like crucial step to really stabilizing what those team meetings are going to look like. And I know that's probably something you're already trying, and it can be frustrating when it's not working. But I would definitely recommend you can reach out to us. We have 2 folks who specialize in rural areas that can help think through some more options for your teams, Marissa. So in our protocols, would you suggest a separate protocol section for our rural law enforcement agencies? Yeah, so I think this is just going to depend on your team. So if your team covers both a rural area and a more urban area, it could be helpful to separate that out. It's always very helpful to have the disciplines have very specific sections. I've even seen folks do it down to the agency level. So we want all law enforcement to have the same response generally, and then each agency writes out what their specific response looks like, and it just matches the general law enforcement response. So my suggestion there is it's going to really depend on what works best for your community. So I would really check in with the law enforcement agencies about what makes the most sense to them for how that's represented in the protocol. Let's see, I have one more question. I'm the county attorney victim advocate. The established SART is constructed by the crisis center, who's not inviting us to be part of the team and not really wanting a second advocate in the small town. That's really tough. Yeah, that's a really tough situation to be in. I think in that kind of situation, again, I'm going to go back to the relationship development piece. So really focusing on developing your relationship with that crisis center, which I know is, again, probably something you've already been trying to do. But really developing that relationship and figuring out different ways to make it a reciprocal relationship. And so eventually that you'll be part of that team. I've seen this happen a few different ways, where different folks want to be invited to the team and they're not being invited to the team. And it really often will come down to those relationships. So maybe there's like a historical reason that folks have some kind of conflict that maybe predates you, and breaking through that can be a bit of a challenge. But I would really suggest focusing on the relationships. Because I think too, like you could reach out to different members of the team, but then that might create even more conflict with the team, which we would want to avoid as well. And really stressing the differences in your role. So as the county attorney's victim advocate, your role is really focused on the systems-based, helping survivors go through that criminal legal process, which is not something that community-based programs always have access to, as far as providing that same kind of support. And so focusing on how you both can really work together to improve the experience for the survivors, I think might be a good place to start. But again, that's a really tough situation to be in. So feel free to always reach out to us if you want to brainstorm more about ways to get more involved in your team. All right, I think I have time for one more question. So when you touched on high quality protocol setting up survivors to have consistency in response, does that mean with each entry point organization or across all organizations? Yeah, so I think I would say with each entry point, because every organization is going to respond based on the like values and objectives of that organization, right? Like, so a community-based advocacy program is going to respond very differently from law enforcement or from the forensic nurse examiner, right? And so those are all going to be different, but we want to think about like every time a survivor comes to a community-based program, we want that response to be the same. And every time the survivor goes to the hospital, we want that response to be the same. And every time a survivor reports or calls 911, we want that response to be consistent, right? So that's what I mean by the consistency in response. Does that make sense? Awesome. All right, it is 3:30. You all had some amazing questions. I really appreciate you all being here. So it's 3:30, so I'm going to let you all go. But thank you again for attending. There is a webinar feedback survey. We really appreciate any feedback you have on our training. This really helps us to improve and create even better trainings for you in the future. I also have my contact information on the website. So and our website. So if you need any support, I know some of you all had some really tough questions. So if you want to talk one-on-one with us about some of those questions, please feel free to email me. I'll leave this slide up for a few minutes so that folks can take down our email and contact information. But feel free to reach out to us and we are more than happy to continue supporting as you work on your protocols.